Hi, my name is Robert Kluke, and I'm going to say it was possibly 15 years ago that I had trouble urinating, and so I lived with it for quite a while, and then eventually I went to my regular family physician, and that doctor told me I should see a urologist, and he was very concerned about my kidneys at the time. So I ended up coming to Georgia Urology, met Dr. Stites.
My name is John Stites. I'm with Georgia Urology. I practice in Decatur and Conyers and Midtown, and treat, and offer a variety of BPH treatments. So one of the most common things that people come in for is men come in because they're not voiding normally anymore. It's usually a gradual problem. It's something that has been mounting for a while, and most men come in after they've sustained a good amount of bother already. They sort of reach a limit because they're afraid of how involved is the workup going to be, how invasive, how embarrassing is this going to get. A lot of pain, new discomforts, and a very new realm for them.
Some of my issues were that I had to urinate frequently, so it never seemed like I could completely drain the bladder, so it was almost constant having to go back. And then I would try to, if I was involved with something that was very important, I just would not urinate. For whatever reason, my mind could tell me not to do it. And at night, sometimes I would get up 3 or 4 times during the night. But I think my biggest concern is that just the repeated, even all day long, of not having the ability to drain the bladder really impacted my whole life. He explained to me 3 different procedures that I had the option for, and I chose the Urolift, and I can tell you I was apprehensive, a little nervous, but he explained it very well, and I went through the procedure, and now I will tell you that thank goodness I did.
The Urolift system is it's a procedure done through a camera, wherein a camera is inserted into the urethra, and it's used to visualize and compress the prostate tissue that's closing in from the sides. Using the system, we compress the tissue and we deploy a needle that goes through the tissue, deploys, and will anchor the capsule of the prostate to the inside and suspend it just like the sash of a curtain. We put in as many implants as we need to get there. On average, it's about 4 in the vast majority of men, sometimes a little more, a little less, but enough to get an open channel. It gets you the same, a similar degree of relief. It gets you a similar degree of urine flow improvement, of symptom improvement, but it saves you a month-long recovery, a night in the hospital, an extensive catheter duration, and in some cases, any catheter at all. Okay, so this is a tremendous relief, and honestly, it feels like we're cheating.
I took the laughing gas, and it just felt like a lot of pressure again. It was over very quickly, and the recovery from that one, again, was remarkable. I mean, I came out of the office, and sure enough, I had to urinate quickly. There was a little bit of blood, but the next day, minimal blood.
We typically see rapid improvement in the flow first, in terms of symptom improvement. Better flow, better emptying, a stronger stream is usually the first symptom to improve. We start seeing gradual improvement in nighttime urination, frequent urination during the day, in the first 2 to 3 weeks, typically by about 1 month.
You look back at it, you don't even think about the pain. I mean, and the pain was minimal to begin with. It was more just like a pressure, but you don't even think about it. All you think about is the quality of life you have now, which is 100% better than what I had before. There's no question I would have done it sooner, and I would have tried to get more information about it, because I had no clue what my options were until I came to Georgia Urology. And when I saw those 3 options, I immediately said to myself, that's going to work. And sure enough, it was successful.